just wondering, is the province talking to Saskatchewan about its reopening plan? It's the first province to release sort of a 3-stage gradual reopening by early July that would be based on the number of people in each cohort who are vaccinated. What is BC's, discussions with Saskatchewan, and are we looking to a reopening plan similar to that?
We had many discussions nationally with my counterparts across the country, though I will say that Saskatchewan's plan came out a little bit of a surprise to most of my colleagues, our CCMOH colleagues, and we did have an ongoing discussion about that yesterday on our usual Sunday call. Here in BC, we have always had our own restart plan, as we had the first, and we have been working across government with advice from public health, and it's being led by the Deputy for the Premier, but with all of government and our stakeholders for our Restart 2.0, if you want to call it that. We do need to look at a number of different factors. So it's not going to be just based on immunization, but that will be one of the important factors. And I think we can look what Saskatchewan has, what the UK has put out, the modelling that we've seen both here in BC, but also nationally, that shows that once you get to a certain level of immunization of adults in particular, that we start to see a rapid decrease in transmission. So we will be looking at all of those things. The important things that we need to really keep in mind are the goals of our pandemic response. The number one goal is to reduce morbidity and mortality, so sickness and death from this virus. And immunization is one of the most important tools that we now have to do that. The second is to make sure we're not overwhelming our healthcare system. And right now, we still have very high rates of hospitalization, as you know, and of people in ICU. So we need to balance that over the next little while. And then, of course, we want to minimize the disruption that we are having on society. So all of those things will be considered, and we will have more details. We are absolutely talking with our colleagues across the country, but very specifically charting our course here in BC.
Saskatchewan's plan is very much based on vaccination, just like Katie was asking. You mentioned that ours would include other things other than vaccination. Can you explain what that is? And do you believe that having a reopening plan like this will provide an impetus for people to go get vaccinated, or something for people to look for specifically around when they can do certain things like, go to an event or go to a library with higher capacity? Do you think it would provide some additional support for people towards that goal?
Well, I think there's really two things about it, and we want to look at where where it has been most impacted, and of course, we look at food and restaurant and tourism and those sectors, but we also look at where things have worked really well. And here in BC, we've kept most retailers open, especially small retailers. We've been able to keep many businesses functioning safely with the COVID safety plans. So a lot of our work will be focused on those sectors where there needs to be specific things, and then we'll be looking at the 7-day rolling average of cases, the information that we present regularly that's on the BC CDC website. We'll be looking at hospitalizations, people in ICU. We'll be looking at the morbidity and mortality, how many people are in hospital, how many people are thankfully fewer and fewer passing away from COVID-19. So immunization does two things. One, it has a personal benefit for me. I'm protected from my own personal health, but it also has a community benefit. So immunization rates are just one of the factors, but a really important factor. And yes, that we will be looking at a vision of where our post-pandemic world is going to be, recognizing that this virus is going to be with us for some time. We don't know how long, likely years. It may be a time when it turns into yet another respiratory virus that doesn't cause severe illness in most people. And that's where we hope to get with immunization. So part of our restart plan will be, how do we gradually go back to those important things that we've missed in our lives over this past year? How do we do that slowly? recognizing that not everybody's risk tolerance is the same, and we need to get more comfortable with larger numbers, doing more things in more places, and there'll be a transition period as we learn as we go over the next little while. But we have, and I think you can look to the UK, who's several months ahead of us in terms of both the immunization rates and reopening. And if you do things too quickly, we know this virus can surge very quickly, even in people who are immunized. So we need to look at what we can do personally with a small group of people once we are all protected, or relatively protected, and then what we can do as a community, whether it's in a workplace, whether it's in having social gatherings at a larger amount. And I think it's safe to say that we can be looking at going up to larger numbers of people being able to gather for important ceremonies. Last summer we had the limit of 50, and that was a good transition for a period of time. Then we can look at larger numbers. So it is more details will be coming, of course, but I think it's important that there is a vision for us getting out of this pandemic and getting back to those important connections in our lives.
I know you'd expect me to say this, Richard, but I think it's important to live in the present as well. Right now, it's very important. What we've seen over the weekend is better than what we saw before, but still 596, 605. 558 cases, still 415 people currently in hospital, 20 people passed away over 3 days, 150 people in ICU. And that means we have to be in the moment now. I know Saskatchewan's plan, and one thinks about the next phase, but we've got to live very much in the present right now. And that means following public health orders, following public health guidance, getting registered and getting vaccinated. If we can do that now, it opens up opportunities later. But we got to remember the present is not the opening up. The present are the orders that are in place, the guidance that is in place, sticking local, and doing everything you can, and getting vaccinated, getting registered, and getting vaccinated.
Richard, do you have a follow-up?
Dr. Henry, you mentioned positivity rates. We're seeing different levels of positivity and different caseloads in different parts of the province. Is there any way, as part of this reopening, that we would have a regional approach, i.e. people in areas of lower transmission would be able to do things that places with higher transmission would not be able to do? And to Minister Dix's point, he says living in the present, how much heads up will you give to restaurants and other industries who will need to hire people back as they move back to a transition to normalcy?
Yeah, so that is something that we have ongoing consultations. My office has met every 2 weeks pretty much for the last year with people like the Restaurant Association. So those are ongoing discussions. We understand for many different industries there's a lead time that can be weeks to months depending on where we're going. So yes, we will continue to have those consultations and give people the lead time that they need. I'm sorry.
Will they get lead time in front of the decision is the question.
But you had another question at the beginning, which I've lost. I'm sorry.
Yeah, regional. Whether different restrictions would be in different places based on.
I think we have learned through this. We've tried on 2 occasions to do things regionally and recognize that we are connected across this province and across this country in many ways through travel. This virus is a virus that spread from people to people, and our risk goes with us from where we come, and we take it to where we're going, and we take that risk back with us. And we can see, we only need to look at my colleagues in Nova Scotia right now to see that things can change very, very quickly with this virus. So we have always, we've maintained an approach of doing it together here in the province, and I don't see that changing. We've seen that this virus can cause dramatic effects in many communities across the province, and we're not yet at the point where we have enough immunity across the province that we can do things differently. So a consistent approach has worked for us and will continue to work for us. If we learn new things and if we get to a place where there's evidence that supports doing things differently in different communities, then we will continue to look at that. But right now, I think we can expect to go through this next phase together as we have been for the last year and a bit.